Good afternoon, everyone. I'm Dr. Sindhuri, obstetrician and gynecologist at Ankura Hospital, Banjara Hills. So today we'll be talking about cervical cancer, as this is a cervical cancer awareness month. So what is cervical cancer? Cervical cancer is the cancer which occurs to the cervix, which is actually the mouth of the uterus. So as you can see back with the model, this is the uterus and this is the cervix. This is the entrance of the uterus. So cervical cancer basically affects this region. So what are the symptoms? Many people in early stages are asymptomatic. Mainly the symptoms are like intermenstrual spotting, means bleeding in between the menstrual cycles, postcoital bleeding, which is bleeding after sexual intercourse, and sudden loss of weight, and loss of appetite also can be there. So mostly in advanced stages only you will get the symptoms. In early stages they'll be asymptomatic. So what are the causes? Mainly a virus called human papilloma virus actually is the cause for the cervical cancer. Rest other causes like early sexual intercourse, multiple sexual partners. So there are many other factors which affect which can lead to the cervical cancer. Today we'll be particularly discussing about the vaccination which is there for cervical cancer, and how to prevent and get vaccinated before getting the cervical cancer. So first thing, coming to screening. For screening, we have a test called Pap smear, which actually detects the cervical cancer. So Pap smear, basically we take a smear from this part of the cervix. So this detects early stages of cervical cancer also. Like so in nowadays we are including this Pap smear test in all the women's health checkups, because cervical cancer has been raising in incidence. More than 200 women die in every day because of cervical cancer. So we need to get awareness regarding this cervical cancer. So we are including for every woman who come to our checkup, so who are sexually active, we advise them to go and get a Pap smear test done. So who all can get a Pap smear test done? As I already said, women who are sexually active can get a Pap smear test done. How frequently? First, initially, first 3 years, every year we advise them a Pap smear. If it is negative, you can repeat it after every 3 years from there. So coming to vaccination, there are two types of vaccines. As we all know, prevention is better than cure. So it's always better, if you have a vaccine, better take the vaccination. So two types of vaccine, there are Cervax and Gardasil. Nowadays, new vaccine called Gardasil 9 have also been there. So Cervax is a vaccine which actually gives protection against mainly two types of strains, that is Hpv 16 and 18. So Gardasil gives a broad spectrum of protection for 16, 18, 31 also, 31 and 33 also. So you can take either of the vaccines. It's not specific that you need to take Cervax only or Gardasil only. And coming to Gardasil 9, it gives more broad spectrum of coverage, like for 16, 18, 31, 33, 45, and so on. More coverage rather than this Gardasil, plain Gardasil. So coming to vaccination schedules, first coming to Cervax, from the age group of 9 to 14, Cervax you can take in 2 doses. That is, suppose you take Cervax vaccine today, the second dose will be 6 months later. So after 14 years, you have to take 3 doses. That is, suppose you will take a first dose today, next will be 1 month later, and the next will be 6 months later. During this vaccination schedule, we advise the women not to get pregnant, and pregnants are not advised to take the vaccines. And coming to Gardasil vaccine, Gardasil, we advise the vaccination schedule is, suppose you take today the first dose from the age group of 9 to 14. First dose now, and the second dose will be 6 months later. The same as Cervax. And coming to age group between 14 to 45, whatever. So the first dose will be today, second dose will be 2 months later, third dose will be 6 months later. So that is the only difference between Cervax and the Gardasil vaccination schedule. And coming to Gardasil 9, similar to Gardasil only, you can take the vaccination will be taken in 0, 2, and 6 months. Coming to the cost, Gardasil and Cervax more or less cost you the same. But Gardasil 9 is a little more expensive because it covers more number of human papillomavirus strains. So, because there is a vaccine for a cancer which can prevent you from getting cancer, we advise all women who are sexually active to take the vaccine. Not only sexually active, any woman, any child above the age of 9 can take the vaccine. So as I in the specific schedules that I have already told. So this vaccination actually helps and fights against the HPV virus. Suppose a woman aging around 40 years wants to get vaccinated. You can get yourself vaccinated, but before getting vaccinated, you need to check for your HPV in your body. How will this HPV be checked? The HPV test will be done similar to a pap smear. So if you test negative for the HPV, then you can go and get vaccinated. Because for an existing cancer, this vaccine doesn't work. Like if you're already infected with HPV, this vaccine doesn't work. So we advise the women to take it as early as possible. For best results will be there once if it is taken before the first sexual intercourse. And how effective? Yes, it is definitely very effective. There has been studies that it has been 90 to 95% effective. The people who have taken the vaccine and who have not taken the vaccine, comparingly, 95% chances that you will not get cervical cancer after taking the vaccination. Then why to delay? So please go and get your vaccination done. Suppose cervical cancer can also be caused with multiple sexual partners and all. So what are the things that you can do to avoid getting a cancer and getting the virus? That is, avoid multiple sexual partners, use a condom while having sexual intercourse, and avoid early sexual intercourse. So these are some of the things that you can do to prevent yourself from getting cervical cancer. And we are discussing this because the incidence is raising, but compared to 1970s and compared to mid of 2000s, 2000 year, 2000 means this 2015 or something like that. So the incidence of cervical cancer has dropped by 50%. Why? Because there is a good screening done nowadays, as I first discussed about pap smear. So pap smear detects maximum number of precancerous lesions also. So we advise every woman who is sexually active to go and get a pap smear test done. It's a very simple OP procedure. You need not have to worry for the pap smear. So go yourself screen. Go get yourself screened first. And then why the incidence have decreased? Because younger women are getting vaccinated. So vaccination helps and plays a very key role. Nowadays, COVID vaccine also is helping and playing a key role. Similarly, this cervical cancer vaccination also plays a very key role. So women, whoever comes to our clinic, we specifically tell them, not only in this cervical cancer awareness month, but every time whoever comes, we advise them to get a pap smear test checked up, and even get a vaccination also done. And coming to the vaccination's additional benefits, see, this human papillomavirus not only causes cervical cancer, it can cause vaginal cancers, vulval cancers, anogenital warts, and even head and neck cancers also it causes. Not only women, in men, head and neck cancers are also caused by some of the HPV viruses. So taking this vaccines actually prevents to some extent vaginal and vulval cancers and anogenital warts also. Especially Gardasil have an additional protection for this not only cervical cancer, but also it protects against to some extent not getting vaginal and vulval cancers and even anogenital warts also, as this Gardasil vaccine gives a broad spectrum of coverage for HPV like 16, 18, 31, 33 also. You can as well take Gardasil 9, which is currently being used in US also, because it has a very broad spectrum which covers some of the strains that causes head and neck cancers also. So men also can take this vaccine. It's not that definitely only women should take. No, both men and women can take. So today, as I'm giving you awareness, it's your responsibility to share it to your friends, family. Get yourself, your daughters, your friends, sisters also vaccinated for this cervical cancer. So where can you get the vaccines done? So you can go and meet a gynecologist. So they will suggest you and they will get you vaccinated for the cervical cancer. Symptoms we discussed, and incidents I already mentioned. Prevention is vaccination. See, there are so many cancers which doesn't have vaccines, but cervical cancer do have a vaccine. Suppose you take breast cancer, that doesn't have any vaccine. Ovarian cancer doesn't have any vaccine, but cervical cancer has a vaccine. So you please go get vaccinated. Polio also vaccine was there. Indian government had made it a rule that everybody has to get polio vaccine, and now polio is slowly being eradicated. So similarly, we should eradicate completely cervical cancer from our country and from the world itself. So that can be done only with you getting all of the women out there, women and men out there, go get and vaccinated. So currently, we are running a very good package for this cervical cancer awareness month, which includes pap smear, basic health screening, ultrasound, and thyroid, and the gynae consultation. So you yourself go get tested for a pap smear. So nothing to worry about. Like, you need not have to be afraid for the getting a pap smear done. It's like as simple as I discussed. It's a simple OP procedure. It will be mildly uncomfortable, but it is for your health. And so, because cervical cancer is preventable and it can be treated if it is diagnosed early. So get a pap smear done, screen yourself, and get vaccinated. So I believe this was a useful session. So what we learned today is awareness, which I gave you today regarding the vaccination, prevention, and screening also, and the vaccination schedule also I have discussed. And second thing, screening. I mentioned the screening, that is pap smear test, and vaccination I discussed already. So spread awareness, save lives, get vaccinated get yourself and all your friends and family vaccinated, and save lives. So if you have any questions, you can just ask so that I'll be able to answer it.